Hello, my name is Dr. Tammy Hendricks, and I am a pediatrician who works at the Solano County Family Health Services Clinic in Vallejo. I'm also a professor of pediatrics with Touro University, California, College of Osteopathic Medicine.
Hi, my name is Dr. Patricia Molina, and I'm a pediatrician with Kaiser Vacaville. I'm also a mother of three.
Yes, that's a great point. I am also a mother of two. So you have with you today two parents, working mothers, two pediatricians, and we are here to help answer questions that you have about the COVID-19 vaccinations for children. Both of us have received a number of questions, both in our clinical practice, as well as from our friends and family members about these vaccines. And so we're hoping that this video will help to clarify some of the details, help to spread education, and help people to feel more comfortable as they make the decisions about what's best for their children and their families.
That's right. We hope to this is helpful for you to make the right decision for your family.
Excellent. Do you want to go ahead and get started?
Yeah. And again, these questions come from our clinical practice, but also from what we hear in our community and in our practice. So, Dr. Hendricks, one of the most common questions that I hear is, are these vaccines safe for children?
Yeah, absolutely. I think as parents, that's our biggest concern. With anything in medicine, we are weighing the risks and benefits, right? Even giving your child some Tylenol, you're weighing the risks and benefits. What's the risk of giving this medication to my child? And what are the benefits that I'm hoping they're going to get from it? I see vaccines as very similar, right? We're weighing the risks and benefits. What are the risks of giving my child this vaccine? And what are the benefits that we could expect from it? So luckily, the Pfizer vaccine had been given emergency authorization use for 16 and up. And so we have already seen, outside of the clinical trials that they did to make sure that these were safe, we've already seen millions of 16 and 17-year-olds receive this vaccine, and we've been able to follow them closely and see what type of effects that they have. And luckily, it has shown to be really, really safe. They did great clinical trials for the ages of 12 to 15, which is the current age that has emergency authorization use. And those clinical trials actually showed that the vaccine was more effective, meaning that none of the children actually who received the vaccine during the trial got COVID at all. We know in adults, a small percentage of adults who received the vaccine did get COVID, but at least in the trial data, none of the kids who got the COVID vaccine actually went on to get COVID, whereas children in the placebo group, the ones who didn't actually get the vaccine, some of them did get the virus or the disease. So from the data that we have, it certainly seems to be a very, very safe vaccine.
That's correct. And we've seen a great response so far from the 12 to 15-year-olds. So, yeah.
Absolutely. One of the other common questions that I receive is, what are the side effects from the vaccine? How's my child going to feel after they receive it?
Yeah, that's definitely a common question. So, similar to the side effects that we see with adults, a sore arm, and a little bit of fatigue. Some kids have complained of headaches, but not really horrible headaches, just, enough for them to feel a little bit under the weather. These side effects are pretty similar to a lot of other vaccines, but kids tend to tolerate it pretty well. Just as an aside, my 12-year-old got her first dose about a week and a half ago, and we were so happy that she did. And the major complaint that she had was that she was fatigued. So she went to bed a little early, and that's about it. Next day, she was good to go. Went to school, did her exercise, and she was fine. So, and that's pretty similar to what I'm seeing. I think for most kids, removing that Band-Aid is the toughest thing for them, versus the vaccine, but they're tolerating it pretty well.
Absolutely. Yeah, I would definitely agree. And I know, I was anticipating back when I got my vaccine a while ago, I was anticipating to have all of these side effects because we know that the side effects mean that your body's mounting a good immune response, which is what we want. And so I was actually a little disappointed. Disappointed is not the right word, but surprised that, I had a sore arm and maybe I felt a little tired, but I often feel a little tired. Yeah, I thought, oh no, does that mean that my body's not mounting a response? And it absolutely doesn't, right? The different people, just the same as, different people who contract COVID, some people get really, really sick. Some people are asymptomatic and don't have any symptoms. And so if your child does not have any side effects after the vaccine, that doesn't mean that it didn't work. It doesn't mean that their body doesn't have that great immune response.
Yeah, I always tell families, we're not all robots. We all react very differently to different things. And so, hopefully they don't have, huge, a high fever, right? But if they do, it's okay to do Tylenol. It's okay to do Motrin if they feel pretty yucky. But most of the time they do okay and the fever's not that high. So yeah. So another common question that we get is if kids, if they get COVID, they tend not to get serious disease, right? A serious infection. Most of them tolerate it pretty well. So if this is the case, why should they get the COVID vaccine if their illness is not so severe?
Yeah, absolutely. That's such an excellent question. And I think early on in the pandemic, that is what we saw. Most of the people who were getting COVID and who were getting really sick and being in the hospital or even dying from COVID were older individuals. And so it really didn't seem like it was impacting kids as much. One of the things that I have definitely seen in my practice, and one of the things that concerns me the most with my own children, is actually not necessarily the COVID infection itself. Because what we see is some kids will get COVID and they may be asymptomatic, meaning they feel fine. They don't even know that they have COVID. Maybe they were just tested because they were exposed to somebody. But then a couple months later, they start to get really, really sick. The multi-system inflammatory syndrome in children, MIS-C, that we've seen is a disease that seems to happen after after a child has had COVID, and it impacts their organs. And so we see children go into liver failure and kidney failure. It can impact their brain, their heart, and can have some long-lasting effects. And that doesn't happen too often, but when it happens, it's really, really serious. We've also had, just in our country alone, over 300 pediatric deaths of COVID, which in the grand scheme of things, when you look at all of the deaths from COVID, it's not a lot, but any loss of a child is devastating. And so we know that children can and do get it. And then it's really those longer lasting effects that make me the most concerned. I have a good friend who is a pediatric cardiologist, and he was telling me, about the long COVID that he's seeing in kids. So kids who've had COVID in the past, whose hearts still just haven't quite recovered. And so he was saying how heartbreaking it is to tell a young athlete that they can't be cleared to play because their hearts just haven't fully recovered yet. And so there are longer term implications, and it can be dangerous for kids.
Exactly. And it's something that's preventable, right? And so we can do something about that by vaccinating. And the other important thing is that we know children are carriers of COVID, right? So we know that they can bring it home, to grandma, to grandpa, and they may have more serious disease. So, that is a very important reason to get children vaccinated and to return back to normal. As an aside, we have been seeing a lot of, sadness, a lot of depression, a lot of anxiety, because we've taken these young kids out of their routine, out of school, out of sports. And, by vaccinating them, that's one way that we can all get back to normal, all get back to, what life was like, 2 years ago, right?
Yeah, absolutely. And those mental health impacts of this period of isolation, I think are going to be pretty long lasting as well, and something that we can really do something about. The sooner we can get kids back interacting with other people, the better, for sure. One of the other questions that we get all the time is, will the vaccines provide long-term protection?
Yeah, it's an amazing question. And at this point, we don't know yet. This is relatively new. And what we do know is that there's ongoing research. So from the first person that got vaccinated, we've been doing research to see, do they still have long lasting antibodies? Do they contract COVID? So more is yet to come. And a frequent thing that I hear from families is, well, is this going to be a yearly thing? Are we going to get boosters like we do for flu? And we still don't know. More information is coming. That's part of science. As we learn more, we tend to, bring it to the public, right? But we just don't know quite yet.
Yeah, absolutely. And we are still studying it, right? So still checking antibody levels of people who have been vaccinated to see how long those antibody levels stay high. One of the things that we have seen is when people contract COVID naturally, meaning they get COVID and they develop antibodies, it seems like their antibodies typically last, between 60 to 90 days. The antibodies from the vaccine seem to last a whole lot longer than that. So I think that's a little added benefit, is you seem to be protected for longer. How long? We don't know yet, but a whole lot longer. I think here in the States, we've been vaccinating people since about December. And so, all of those people are now going on about 6 months now and still holding strong. And so it's looking good. But yeah, as Dr. Molina says, we'll have to wait and see.
I mean, that is science, right? Wait and see. Yeah. Great. So, let's move on to, there's a lot of information or a lot of news about these variants out there. Do you know if the vaccines protect against the variants?
Yeah, that was another one of my big concerns, just personally, right? As we were getting vaccinated, we started hearing about all of these different variants. And so, the way that the vaccine works is it gives a little piece of messenger RNA to us, which goes into our cells. Our cells read it and then make the protein. That's that piece of the messenger RNA. That's the message it's carrying, is to make the spike protein, right? Which is the little thing on top of the SARS-CoV-2 virus, right? The little circle, so the things that give the little horns. And then we make the spike protein and our bodies start to develop antibodies to it. That antibody response, we know, is a very broad response, which is fantastic and relieving, meaning that it does seem like the vaccine is holding strong against the variants that are out there. We know that people are at risk. Even once you get vaccinated, there's a chance that you could get COVID. But one of the things that the vaccination for adults really seems to protect against, and we're assuming for children too, although children haven't gotten COVID with it from the trials, is it protects against the serious disease and illness. So even if you get COVID, even if you get one of those variants, you're still not ending up in the hospital. You're still not dying. Your lungs still aren't failing. And so it does seem to be providing that good protection. Once again, more science is needed, right? We're continuing to study this constantly. But for now, it's looking really, really good.
Yeah, great.
So another question that I get a lot, and this varies depending on the individual, but if my child has an underlying condition, and so things that I've heard are like a peanut allergy or like severe asthma or cerebral palsy, can they still be vaccinated?
Yeah, that I hear that on a daily basis at work. And the answer is absolutely. The only contraindication, okay, the only reason why we recommend that you do not get the vaccination is if you've ever had a reaction to any of the ingredients, if you've ever had a reaction to an mRNA vaccine. And, the number of people that has been the case is pretty small. And so, if you have a penicillin allergy or amoxicillin, which is an antibiotic we use a lot in pediatrics, that is still okay for you to get the vaccine, for your child to get the vaccine. So, there's not that many reasons why you can't. Yeah.
Absolutely. And a lot of the reasons that parents will bring up to me are reasons why I want their child to be protected.
Mm.
They're at extra risk if they were to get COVID. And so yeah, I absolutely agree.
And Dr. Hendricks, there is a lot of parents want to know what is in this vaccine? What are the ingredients, right? Because a lot of families want to do their research online on these ingredients to see if they've ever had any reaction to any of these. Can you tell us about that?
Yeah, absolutely. So I have definitely not memorized all of the ingredients in the vaccine, but luckily it is readily available. And so, if anybody's interested, and I can even put a link maybe with the YouTube video where you could go so you can look at all of the vaccines. I think some of the big things that people are worried about are there preservatives in these vaccines? Are there eggs in these vaccines? Are they made from eggs? Are there is it made with latex? Any of kind of the more common allergens. And no, there are no eggs, there's no preservatives, there's no latex, none of those things in the vaccine.
Yeah, that's great. And don't memorize ingredients, people. Our brain power is, we can always look it up, right?
So I often get asked as well, and this is true for me too, because my kids are not yet 12. My oldest is just turning 11 this summer, so she's so close. But when's the vaccine going to be available for younger children?
Yeah, that's a great question. And me too. I have two that are still pending to get vaccinated, and my kids. Currently there is research that's still happening for the younger age groups. And so, traditionally, what science does is we wait to see if it's safe for the older, for adults first, then we move down in age groups. All vaccines have been done this way. And so now that we know that it's safe and it's proven that it's safe for 12 to 15, we move down the age bracket. And so currently there's clinical trials going on. And until we know it's safe, then the little ones can't be vaccinated. But so far, what I hear is that it's very safe, that it's going very well, that they're responding just as well as the 12 to 15 and 16 and up. And so, it's promising, but we don't have a date yet. I hear in, rumors in the background that it may be as early as fall, but maybe, winter of next year. And so that is, 2022, early 2022 is what almost everyone is predicting. So
Absolutely.
keeping our, fingers crossed that it goes well, because I can't wait for my little ones to get this if it's safe.
Yeah, I agree. I think the CEO of Pfizer has been on the record as saying that they're going to, really aim for submitting for that emergency authorization use for kids younger than 12 in September, which would be amazing because that's right around the corner. But yeah, as you say, they're still ongoing with the clinical trials. And, one of the things, children are not just small adults. And so we can't treat them that way. They are anatomically, physiologically, developmentally different than adults. And so making sure that, the vaccine dosage is okay. Right now, the same dose is used for 12 all the way through to adulthood. And that has been shown to be safe and effective. But that may not be the case as we start to look at smaller children. And so there's so much more data that needs to be collected and research that needs to be done before we can really say confidently, this is going to be safe for those younger children. Awesome.
Now, the next question, Dr. Hendricks, is one that I think has been the most passionately asked by families, right? Because they are hesitant. They hear on the news that this vaccine somehow is tied to infertility. And so families don't want to do anything to their kids and their future reproductive, later on, right? Down the years. What do you say to families when they ask, is it safe for fertility later on?
Yeah, absolutely. This is a question that I started receiving early on when they first started talking about, even starting to be able to give the vaccine to 12 and up. And so I had to do a lot of research on it myself. It was something that I wasn't all that familiar with. And I wanted to make sure that I was giving my patients, my family, my friends, all the right information. And so I needed to really look up, where is this coming from? So what we know from getting COVID is people have gotten COVID and recovered from it and gone on to have children. We know that adults have been vaccinated and then gotten pregnant. And so we know that COVID itself and the vaccine itself doesn't seem to impact fertility at all. But yet there has been this big concern about, potential long-term fertility issues. And so in the research that I did, it looks like, one of the things that made people concerned was the messenger RNA that I talked about. It is coding for the spike protein. And it looks like some people were concerned that spike protein looked similar to a protein that is in the placenta or in the uterus of a woman when she's going to be pregnant or about to get pregnant. And so if your body is developing antibodies to the spike protein, then could your body also develop antibodies to these natural proteins that are in a woman's reproductive system? And so I think that is at least where my research took me as to where this concern was coming from. And the reality is, no, the spike protein looks very, very different than the protein that I, heard spoken about, but really than any of the other proteins that are in the woman's reproductive system. And as I said, I think, the proof of what we have is the number of women who've been vaccinated or who have had COVID or who have had COVID and been vaccinated and have still gone on to conceive. Fertility rates have not changed at all. During this time period. And so I think that is all very reassuring.
Yeah, I mean, great explanation. And that is, like I said, something that's very passionate to a lot of people and the most common question. So thank you for answering that.
Yeah, absolutely. And it's so understandable, and I know I've also seen a lot of reports of women's menstrual cycles, suddenly changing after they get the vaccine, which, we also know that stress can impact our hormone levels and can impact our menstrual cycles. And so there are so many other variables that, I think it's hard to really say that one thing causes, the menstrual changes. So one of the other questions that we hear quite a bit is, were fetal cells used in the development of the COVID-19 vaccines? I know that is a big concern for a good portion of our population.
Yeah, and it's a good question to ask, right? A lot of families have deep beliefs that they feel that it would be incorrect to get the vaccine. But what we know is that fetal cells were not used they're not contained in the vaccine. They did use the fetal cell lines in testing the vaccine, but there's no fetal cells in it. So, when I first started reading about this, I also read a lot of religious leaders actually, telling their followers it is safe to do so. It is, we are okay with this. So we have, gotten, like, it feels like a permission from our religious leaders for this, right? And they understand that this is the safest thing to get our, friends and family and our loved ones and our followers to back to your place of worship. And so, but yes, we did not have any fetal cell lines within the vaccine.
Yeah, absolutely. And this is also something that I have researched as well, once again, just to make sure that I'm being truthful, and being able to provide answers that my patients are interested in and need for kind of all vaccines. So when we talk about fetal cell lines, I think it's important to highlight what that means. The fetal cells were harvested back in the 60s, and then those cells were propagated, meaning they grew those cells to make more and more and more cells. So since the 60s, so the fetal cell lines actually don't contain any fetal cells from, all of those, I want to say 40 years ago, but it's actually 60 years ago, right? 2021, but 60 years ago, right? And so it's really just these cells that have been grown in a laboratory for so long that's used. The Pfizer vaccine in particular didn't use the fetal cell lines at all in the production of the vaccine. As Dr. Molina said, they did use them in testing just to make sure that they were safe, but wasn't used in the production at all.
Right. And currently the Pfizer is the only one that we're able to use to vaccinate children. And so, yeah, so it's just something to point out. Yeah.
Absolutely. Another question that we've been receiving quite a bit, and it's a relatively recent question, at least it's come up more recently than, say, the fertility question or some of the other questions, is the association between myocarditis and the COVID-19 vaccination. So myocarditis is an infection, inflammation of the heart muscle. And so the big concern. And so I wanted to know if you wanted to talk about that just a little bit.
Yeah, it's all over the news. And I've had families ask about this as well. And so when they looked at, children that have gotten the vaccine, okay, and have had myocarditis, and children that have not had the vaccine and had myocarditis, the rates are the same. Okay, the same number of children get myocarditis. This normally happens in the pediatric population, in kids, from many viruses. So if the rates are the same, meaning the numbers are the same for those vaccinated and non-vaccinated, then that means that there's no association at all. So the vaccine did not cause, otherwise we would see a higher rate, a higher number of kids after vaccination. And that is not what the research or the data shows.
Yeah, absolutely. I agree with you. And this is another thing that I researched because I started to get really concerned, right? As pediatricians, we want what you want. We want your children to be safe and healthy. And so the last thing that I wanted was, to find out that something that I have been encouraging my patients to get could actually be potentially causing them harm. Because, from what I was hearing, it was like it happens most often in male children after the second vaccine, right? 4 days after the second vaccine. And it sounded like so specific and so related to the vaccine. Like, how could it happen to all of these male, right? The exact same scenario over and over again. And yes, just as you say, really, when you look at all of the data, it shows that the rates of myocarditis haven't actually increased. So it seems to be, it just happens to be something that happens around the same time when children are getting vaccinated against COVID. And so, if there was a true causation or a true relationship there, the vaccine delivery would be halted, because we wouldn't want to put more kids at risk.
In my patients, when I'm in the exam room and they ask about the vaccine, and my phrase is, I would never do anything to patients that, one, would put you at harm, because that's not the reason why I went into pediatrics. I actually went into pediatrics because I love children and I want to keep children safe. And I also always mention that I wouldn't do anything to my patients that I couldn't do to my own children. And, as I mentioned earlier, if you started, to listen to the questions earlier, is, my 12-year-old has already gotten her first dose, as soon as we could, to get it, because I do believe in the safety of this vaccine. And that is the reason why I'm recommending it to patients, to the community at large, because we do want to keep our patients safe.
Yeah, Yeah, absolutely. I couldn't agree more. I became a pediatrician before I became a mother, and I feel like I became such a better pediatrician once I became a mother. And you realize all of those decisions that you're making as a parent at all times, and just how crucial they are. It's just on a different level. At least it was for me. And so, yes, I completely agree. I would not recommend anything that I wouldn't recommend for my children. And I am just waiting at the gates for them to release the studies on those younger children, so we can see if it's safe for them to get as well.
Great. Almost there.
Thank you so much. I so greatly appreciate your time. And yeah, it's been a pleasure to have this conversation with you.
Yeah. Thanks for listening, everyone.
And if anybody has any further questions, let us know. We'd be happy to jump on another one of these or record another one of these, and help answer people's questions. We really just want to help spread the education so that you can make the right decisions for you and your families.